No vas a cambiar a más. Ay, no me mientas más. Mañana ya es el gran día. Nos vemos. Bueno, aquí estoy como Dios me trajo al mundo, con una batica por encima. Ahorita ya estamos a punto de hacer el procedimiento. Esperemos que todo salga bien, espero que sí, que todo va a salir bien. Estoy rodeada de puros profesionales, desde el anestesista, la enfermera, el doctor, todo el mundo acá. Todo el mundo me está dando tranquilidad, me dan todas las indicaciones, me preguntan todos los detalles para que todo salga bien, no haya ninguna reacción alérgica a la anestesia general. Así que yo creo que 99.99% estoy segura que todo va a salir bien.
Todo va a estar bien, ¿ok, mi amor? Te voy a dar una medicina que puede ser que te date un poquitico, es normal, ¿ok? Tranquilita, que todo está bien. Piensa en cosas buenas, respira profundo, para adentro y para afuera. Poquito a poquito vas a empezar a relajarte y te vas a quedar dormidito, ¿ok? Muy bien. Estás haciendo excelente. Muy bien, muy bien, muy bien. ¿Cómo te sientes?
Vamos a entrar a la cirugía, ya mi sirenita la tienen preparada, ya empezó el procedimiento. Como le prometí a ella, desde el principio hasta el final con ella. Doctor, ¿cómo está mi paciente, mi sirenita? ¿Cómo usted la ve?
Patient's doing good. We're just getting ready to get started. We just put her to sleep. So we're just kind of getting everything ready before the operation starts.
¿Qué tiempo va a durar el procedimiento? ¿Vamos a durar esperando mucho tiempo?
About 2 hours, give or take a little bit, approximately.
Ok, yo estoy nerviosa aquí esperando. Thank you.
No. So you can see here, you know, the first thing we do with any liposuction is we kind of bathe the fat with a fluid. It's called tumescent solution. In there's a little bit of numbing medicine, helps with the anesthesia during and after the operation, so the patient doesn't require as much pain medication. And it also helps to decrease the bleeding during the operation. Most importantly, that's the main thing that it does. So, you know, we kind of let that sit for about, 10 minutes or so before we get going, so we really decrease the amount of bleeding. And, in her case, she's got a lot of fat. You can see she's kind of fluffy. But afterwards, you'll see, and we'll get a photo kind of when we're done doing the liposuction of the abdomen, that she's going to be nice and flat. She's going to have a real tiny little waist because, she's got that kind of body where, once you carve everything out, you're going to leave her with her bones, and she's going to have a nice shape and contour. So. You can see what we're doing is, we're removing the fat. Here's the fat that kind of goes into the tubing, and then we harvest the fat over here where we collect it, and then this is the fat after we kind of drain out all the surrounding fluid. That's the fat that we'll use to re-inject into the buttocks to kind of create her shape and everything. Is that it's not just removing fat, it's all about creating the shape. So, in her case, you kind of want the waist to kind of come in so that when you see her from the front, it kind of narrows down here and then expands to get that hourglass shape. You're going to continue to get more and more of that shape as we go through. That's the most important part of things.
Excelente, ella hizo lo más bien. Fue una buena paciente. No tuvo ningún problema. Ojalá todos mis pacientes fueran así.
So we just completed the liposuction of the abdomen. You can see now, look at it. We got all the fat out. It's pretty nice. You can see her shape now. It's coming in. She's already getting the curve. Most of the curve, believe it or not, in the waistline is from the back, and you'll see that when we do the back next. But you can see how she was beforehand to there. I do use drains. You can see the drain comes here, kind of runs along the lower abdomen. It removes any fluid that's collecting underneath the skin, so the skin sticks down. Usually in there about a week, but it depends on the volume. But overall, we got a lot of fat out. She looks great. She's gonna be super happy with the abdomen. Right now we're gonna flip, and we're gonna do the same process on the back. And then after we do the lipo on the back, then we'll transfer the fat, and then we're all done. And you can see, look at this. Look at this curve in the lower back compared to where she started with. Average person takes pain pills a couple days, you go home with some antibiotics, back to work somewhere around a week or two.